Good evening, everyone. So today I welcome everyone who have joined in this session to a great road to success. So why we kept a name Trumpcard for success? Because now we are all at the stage of COVID. We have missed almost 6 to 7 months of classes. Yet we doesn't know whether the university exams will be getting postponed or whether it's going to be held as per the schedule. So in this time we are supposed to actually start learning, so we have to start preparing ourselves for the examination. Whichever exam, whenever they conduct, we should be able to attain success. So for that there are some tips and tricks which only the experts can tell us. So it is not too late to start with our examination preparation. So here we have Dr. Ajaiy sir, who is an expert, national faculty in ENT, and he is taking millions of students. He is taking class across the nation. Yet he is here today to help everyone in our medicine channel to attain success whenever university exam is conducted. Now coming to Dr. Ajaiy sir, he has completed MS ENT from the prestigious institution MMC in the year 2016. He finished diploma in allergy asthma in the year 2019 from again distinguished institution, our Christian Medical College. Currently, he is working as assistant professor of ENT in Karpagavinayaga Institute of Medical Science, and he is taking classes for the NEET PG examinations across the nation in various coaching centers till date. He has also authored a quick revision like textbook, Triple O textbook of ENT by Dr. Ajaiy. And also he is having his own app, Dr. Ajayy's ENT, which is for the preparation of pre-final years. Now I hand over the session to Dr. Ajaiy sir, who will be sharing all the tips and tricks which are necessary for attending our university exam whenever the exam is conducted. Thank you for joining with us, sir. Now you can continue the session.
Good evening, Raghu. Good evening, all. Thank you for the introduction. And as you said, and welcome all the participants, all the students who are here. And as Dr. Raghunandan was explaining, we don't know whether the university exams will be on date or will be postponed. No one knows it. But actually, as per the schedule and as per whatever the NMC has framed or whatever the new guidelines have framed, in most of the colleges, almost they have took all the online classes, and I hope most of you attended the online classes, or maybe I hope that most of you have muted the video, and you would have done something. But and again, as you said, it's not too late, and I hope in most of the colleges they have almost finished the topics too. So if the scenario comes like the colleges are going to reopen, maybe who knows that we have still 3 more months left. As per the NMC guidelines, you guys have to be in the college for the 2 months before appearing for the exam. So even if you appear on November 16th in the college, you have a December, you have a January, and maybe February you will be getting exams. So no one knows about it. There can be even some changes also, like the postponement can occur, but no one knows regarding that. But obviously, as you said, it's a time to go back to our college and go back to our studies. Obviously, we all had a long session of leave, not us, but you guys had a long session of leave, maybe from the month of March till date, till the last 6 months. Maybe we will kind of call it as a vacation or a boring period, whatever. But still, right now, once we go back to our college, we need to get back to our studies, right? So, and as we all know that in a pre-final we have a subject of ENT, Opthal, and SPM. And ENT, of the 3, ENT is a simple and easy subject to understand and to appear in the exam. Unlike SPM, I hope that for SPM we need to read a lot, like a park and so. And for Opthal, again, it takes some good understanding. And ENT, if you understand the concepts well, it's very easy that you won't forget until you appear for the NEET PG or the next whatever which is appearing for your batch. maybe for the 2022 batch, maybe next would also will come. No one knows regarding that. Maybe the NMC will frame a new guidelines according to it. So we can call it your batch as a lucky batch or whatever, but no issues in it. Right now, as per the ENT is concerned, and obviously we want, right now today is November 7th, and I hope that no one will read till Diwali. So consider that as a November 14th. So actually, when we start preparing for the exams, so what are the tips we need? What are the things we need to study? So we all have an ample time. So I won't say that only we have a reduced number of time. We have 3 more months to read. So obviously, for the first revision, for any exams, I will suggest you to make some 1 or 2 revisions. Okay, the things you want to have in mind, is first thing, just understand the concepts. Okay, just read the book or the app, whatever you have, just read the book. Okay, so in a ENT, what are the things you need to understand, right? So for any subject, maybe a ENT or after or whatever you go to surgery, we want, for any surgical aspects, we want to have a thick knowledge of our anatomy. If we understand our anatomy well, then we can easily crack the other diseases also. So the first thing, how am I going to, so I hope everyone will be versed that, oh God, the colleges are going to reopen and the exams as you put on, and the exams are going to be in February. If so, how am I going to prepare for the exam? So again, it's a burden for me. So once I, hopefully everyone, even I was a student like you. So when we just go back from a long holiday to the college, when we just open our book, we will be feeling sleepy only. That happens. That is a human tendency that we can't change it. But how am I going to plan it? The first thing what you want to plan accordingly is your timetable. So what you want to do is put on a proper timetable. Just decide yourselves, take a proper note, put on a proper timetable. When are you going to read a SPM? When are you going to read the ENT? And when are you going to read the after? Okay. So SPM and after will conserve them. We will take some time. Okay. ENT, again, we can call it as, in my UG days, when I was studying ENT, same thing like you. So usually how we call it as ENT is a term of entertainment. Since what they call as entertainment, since ENT starts with entertainment. So just have in mind, okay, read ENT as an entertainment. Okay, it starts with the ENT and the ends with the ENT. So just understand the concept. So how am I planning to do? Put a proper timetable. For anything, start with a year. Okay, so if I'm going to read a theory, so as I say, for anything, start with the anatomy. Okay, once obviously you would have got some classes which are covered in your college. If not, there are some classes in our medicine platform where there have been some discussion on anatomy, and there are some discussion on other topics on ENT also. So starts with the anatomy. Okay, once you understand the anatomy, then go on to our physiology. Okay, obviously anatomy is a dry subject. As we know, we completed the anatomy in the first year. Okay, the anatomy of ENT, hopefully we would have skipped that topic, but now it's important for us. Okay, once we understand the anatomy of ear, go to the physiology and then come on to the diseases. Without knowing the anatomy, without knowing how our ear is going to function, we can't understand the concepts. Okay, if we know that which is external ear, which is middle ear, which is internal ear, and how is our internal ear is functioning, how is our balance mechanism is going on, and what is the mechanism of our hearing, like whatever we hear going through the pinna, through the external auditory canal, through the tympanic membrane, and then the ossicles and the windows, and then the inner ear, and then the eighth nerve pathway. So this is the physiology. Okay, once we understand the anatomy and the physiology, then the diseases are very, very easy. Okay, so how are they going to frame the questions? Obviously in your exams, there is going to be some question on the anatomy. Maybe nowadays they are asking a essay question like discuss in detail the anatomy of middle ear. So middle ear is a very, very important question for you, the anatomy of middle ear. Okay, and the physiology again, it stands a very, very important. Without knowing the physiology, we can't go to the next topics. And the next thing of important is the audiological evaluation. In our year, we want to have in mind the audiological evaluation. That is, how are we going to evaluate the hearing mechanism? So these are some important concepts without which we can't appear in the ENT exams. Okay, so these are very, very important. Since while appearing in the Viva session or the theory session, this is what they will ask. How are you evaluating? What are the audiological evaluation? Like the main thing, how we want to do a tuning fork test. A practical skills of tuning fork test. Very, very important for all pre-final students. Even though we don't know the other audiometry or the impedance or the BERRA or the OAE, we want to have in mind the tuning fork test. And we want to do the tuning fork test on the patients also. Obviously, you haven't seen the patient till now, but once you appear in the exam, if so, if you get a patient of a year, okay, they will ask you to do a tuning fork test, which is must for you to understand. So you want to have in mind the tuning fork test as a Bible of your ear. So have in mind the Rinnies, the Weber, the ABC, the three important tests which you will do. Okay, Rinnie, Weber, ABC, these three you should know in mind. How are you going to do? What is Rinnie's positive? What is Rinnie's negative? And what are the tests of Weber? And what is absolute bone conduction test at the ABC? So this is all we want to know. Right. So this is how you want to frame a timetable. So start with the year. That's what I will say. Even you haven't started your textbooks, even you haven't started anything on the ENT, never worry about it. So ENT, you can start now, you can finish it, you can just have an understanding within some 3 to 4 weeks. Okay, so if you have not such time like 3 or 4 weeks, if your university exams are on the February 1st week, then you can even make a timetable like read 8 hours a day so that I can even finish it within a 2 weeks also. Okay, the first thing is, first we want to, it's nothing like a mugging up. There is no mugging up, nothing is there in ENT. Okay, maybe in the pathology you will understand that you need to say the definitions as and so define neoplasia. You need to say it perfectly. It's not like in ENT. In ENT, the topic, you understand the concept, you reproduce. Whatever the surgery, how am I going to do the surgery? What is the problem here? And then what are the clinical features the patient is going to present? Right, say, so starting from, okay, the first day you dealt with the anatomy, physiology and the audiological evaluation, have in mind like that. So then we are going ahead with the diseases, right? So what are the diseases which we can come across like, okay, so we can come across the diseases. First thing, before reading the diseases, we need to evaluate the hearing loss. That is, what is the type of hearing loss? In our ENT, we want to understand what is the type of hearing loss. That is, whether it is conductive or whether it is sensorineural. So then only we can understand what are the diseases which come across a conductive, what are the diseases which will be sensorineural. So obviously starting from our pinna to the external atrial canal. So we know that the pinna, external atrial canal, tympanic membrane, and we have some ossicles here, the malleus, incus, and stapes, right? And the stapes will be attached to a oval window. Okay, I'm not going in depth about the theories and all. So we know that there will be a oval window, there will be a round window. This is inner ear. So as per our understanding, just have this one thing in mind. Up to the foot plate of stapes, up to the oval window, from this area to this area, any pathology like a impacted wax or a otosclerosis or a tympanic membrane perforation, whatever, we call it as a conductive hearing loss. Apart from that, after this, the inner ear to the eighth nerve up to the auditory area, it is sensorineural hearing loss. So this is how we classify. I'm making it a bit simple for you so that once you go back to your books or start reading your books, it will be easy. So this is how we want to classify the types of hearing loss, right? Okay, so once I have classified the types of hearing loss, what should I do? What should I do? So the first day I did of something, I finished the anatomy and the physiology. Okay, fine. My timetable, I did well. So the second day or the next day, and after completing the anatomy, go ahead with the other important topics, the diseases of the ear. Okay, it's not that important that even there are some small topics like presbyocusis, noise-induced hearing loss. Just have the concepts in mind. But we have to have in mind the important essay questions like the acute suppurative otitis media, right? Once we start with the acute suppurative otitis media diseases, we know that this is a otitis media, right? And in the otitis, so diseases we are classifying, as we all know, into otitis externa, otitis media, and inner ear diseases, right? Inner ear diseases, they are not going to ask much about it. Probably they may ask some balance mechanism disorders, which hopefully just have that concepts in mind, not much important, like a PPPV kind of thing, benign paroxysmal position vertigo. But for your exams, and as per the university exams, the most important thing what they will ask is this otitis media. And in the otitis media, they are going to ask about the acute suppurative otitis media. Okay, we want to understand what is acute suppurative otitis media, what are the stages of acute suppurative otitis media. Once you have that, once you understand the concepts, then you can, that's what I will say, then you can, even if you don't know the subject, you can write something on it. Okay, so start with the acute suppurative otitis media, but don't end the day there. Go on to the CSOM, chronic suppurative otitis media, finish the safe type there. Safe type is what you get in the exam, that is a case of perforation. Okay, read the topic also. Once you finish the ASOM, you need to go ahead with like a sequelae, finish the chronic suppurative otitis media on that day. And one more thing, have in mind, there is one more important question in it, that is serous otitis media. Serous otitis media. So we know that in a sequelae, the eustachian tube getting affected, acute suppurative otitis media starts, and the infection uncontrolled, it can turn into chronic suppurative otitis media. So that's what I will say for any ENT subject. Understand. Before mucking up, once you read on something, just understand the topic, just take a notes with it. Okay, and then how is it reproducing? Like a ASOM, if it is getting controlled, fine. If it is uncontrolled, it can turn into chronic otitis media. Right. So now, so this is how the questions will be. So the next day, what are we planning to do? So we have done with the CSOM, we have done with the ASOM, and then we want to learn also the complication, which is again very important essay for us. The complications following acute suppurative otitis media, again a very important essay. So in the ENT, when you ask me what are the important questions, again, the entire chapter is very much smaller only. So the questions which are being repeated again and again, the ASOM, the CSOM, the complications, or the next chapter, the cholecytoma. Okay. So these all are very, very important, very, very important. So these are the things which are being repeated again and again in all the university papers. Maybe whatever the university, the deemed university, you are in a deemed university or MJ university or whatever the medical university you are, then in a ENT, this is what, in a UG, this is what all the examinations will be, whatever you are reading. Like maybe you may be in other universities also, in other country also. But these are the things which are basic for us to get in touch. Okay, so this is how we frame the timetable. And then the next day, so we have done with the complications. Obviously, complications are a vast topic. Once you understand, so where it is spreading from the middle ear, it is going to mastoid, and then it can go to the petrous apex, or it can even go to the brain. Once we understand that, the concept is very simple. Right? In the first time when you are reading the textbooks, or when you are reading whatever the platforms you have, the online PPTs or the online apps, what we have, okay, the first time once you read, understand. Okay, read it so that never mug it up, understand the concepts, how it is spreading from one area to other area, and what all the things which are appearing. Remember again, I am saying again to all the participants who are here and who are watching online. So it's not like our non-clinical subjects where we want to have a lot of things in mind. Okay, so now we are entering into a clinical scenario, the ENT, ophthalmology, the next year medicine, surgery, all the clinical subjects. It's like, how are we correlating with the patients? Think that we are the patients. Think before reading any subject, think that we are the patients. Obviously, ENT is a subject in which all are patients. Okay, when you just evaluate a history, obviously everyone will have allergic rhinitis. At any point of time, everyone would have some wax in us. Okay, so we all are the patients. Think that we are the patients. Once I have a wax, or once I have a discharge, what I will think, okay, I may get this complication. So correlate the patient on us. Okay, so once we correlate the symptoms, then understanding is very, very easy. Why I am repeating this again and again is, so now as you appear in 2022, the next exams, Okay, ENT, there are going to be some 60 questions, hopefully, from ENT. And lot of it is going to be depending on your practical skills also. So you want to have in mind the practical understanding of the concepts also. So the next day, so you are finished with this. And then what else we want to plan? Then we want to have in mind then the next important diseases. What are the other diseases which are being asked in essay? Very, very important. The otosclerosis. Okay. What are the things we want to have in otosclerosis? Okay. Say in otosclerosis, so, and some of you have asked that in an exam, how am I supposed to write an essay? Right, some have queried previously. So in an essay, say, okay, they are asking otosclerosis in essay. What they will ask, if I am setting a question paper for you, or if someone else is setting a question paper for you, what they will ask you is define otosclerosis. Okay, what are the clinical features of otosclerosis? Okay, and what are the investigations and the management? Or they will ask you, how are you going to manage a case of otosclerosis? If it's something like a ASOM or a CSOM, chronic suppurative otitis media with the perforation, the same thing. Define CSOM, anything the essay, what they will set you is starting with the define, and then what are the clinical features, and then what are the investigations you will do, and what is the treatment. This is how your clinical scenario will be framed. Okay, so starting, so some have asked, how am I going to write this essay question? So any essay question, once you write, there may be some toppers here, there may be some backbenchers here, and there may be some middle benches there. Never worry about it. See, once we understand the concepts, how am I going to write essay? So start with the definition. They have asked a definition. So start with the definition. It's better in your paper. Okay, in your paper, don't just scribble, just for any question, try to put some line diagrams. Okay, say nowadays, so when I was a UG student, not much years back, maybe I finished my undergraduate in 2012. Okay, so when I was an undergraduate, my way of teachers used to teach me with a pen, with a board and the chalk. That's it. There was no marker, whiteboard marker. There were no other platforms. Okay, and we used to read the books and we used to write something. But nowadays, what has happened? The technology has innovated. So even though you are sitting maybe in a Kanyakumari or maybe in Andhra, wherever, we are communicating from our place to you through this online platforms. So how am I communicating now? With the line diagrams or whatever we are writing. So this is how it's going to reproduce. So writing simply stories doesn't carry much marks for you. If you want some good marks in the exam, have in mind, put on some flowcharts. Okay, so put on some line diagrams. Okay, so even if you have a proper diagram, so if they ask something like anatomy, put on a proper diagram and mark the parts. If they ask anatomy of the ear, put on a proper diagram, mark the parts. Okay, if they have something like a otosclerosis, you can put on some line diagram. What happens in otosclerosis? Say this is a staples. Right, put on a staples like this. Just even everyone will. We don't need any other proper coloring chart, proper crayons or whatever. Just put on a simple line diagram and mark it like there is some pathology here. Okay, which is causing the fixation of foot plate. Okay, once you put a proper line diagram, okay, whatever the theory, like you write otosclerosis is defined as a condition of so and so, whatever, we are not going to read that. When we go for paper correction, okay, we will read all the line by line. But to be frank, when we just see your paper, the one thing which attracts us is the flowchart, the diagrams, okay, and some important key points to be highlighted. Okay, the important key points indicate. So what is it? There's some sign with it, the Schwartz sign. And what are the investigations? We do audiometry, we do a impedance. So these are, you can highlight it. So when I put on the investigation, I can do the pure tone audiometry shows what type of hearing loss it can be. There is a fixation of staples. So it can produce a conductive hearing loss. So this and all, if you highlight the key points, writing stories, the age scenario has gone. So previously, writing stories more and more and putting on that marks with the how many papers you write. So nowadays the scenario has changed. The correction is not depending on how many papers you write. It depends on how you write. Okay, how is the concept understanding for you? How are you reproducing in the paper? Say there are some students, there are some friends of mine who will read for hours and hours of day, but in the exam they don't know how to reproduce it. There are most of my students, I will just teach them only one thing. Once, it's not that mugging up, it's not that. Once you understand, just have it in mind. If possible, while you are reading the book or the app, whatever, take a notes with you. Okay, take a proper notes. Once you take a notes, okay, make sure that you are writing the exam in some points. Don't write in paragraphs and paragraphs. Write in points. So clinical features of otosclerosis. It's nothing like the patient will have a painless. No need to mention that. Have in mind simple. Yeah. What type of hearing loss? The patient is going to have a conductive hearing loss. There is a symptom called as paracosis vilsi. It's not much that you need to write that the patient will have a paracosis vilsi, that is so and so. Just write in points. So writing in points with a proper flow chart, with a proper line diagrams. So line diagram is this one. If they ask in anatomy, if you don't know the line diagram, just simple. Put on a middle ear like a box. That's it. Put on a middle ear like this. Okay. So in the middle ear, we know that what are the walls in the middle ear? We have a medial wall, we have a lateral wall, right? We have a roof, we have a floor. Okay. We have a anterior wall and the posterior wall. So this is how our line diagrams will be. Okay. So whenever you read the books, I myself actually in a surgical chapters, ENT, of the large general surgery or the ortho, whatever you go, I usually will say to my students that have in mind the line diagrams. Your paper will be beautiful only if you put on some line diagrams. Okay. If you put a proper diagram, then it's well and fine. If they are going to ask you, there is one short note like organ of Carti. Okay, put a proper diagram on organ of Carti. Okay, then you need to put on a proper diagram take some colors, put on some colors of the hair cells. Then it's a must. Okay, but if they usually in the exam, what they will say is draw diagrams wherever necessary. Okay, draw diagrams wherever necessary. This is what they will say. So that scenario indicates you need to put on some diagrams. Okay, so similar to that. So whenever you start the essay, as I say, start with the definition, and then what you know, put on the clinical features. Okay, and then before the clinical features, it's better to go ahead with the etiopathologist, that is the etiology, the pathogenesis. Okay, in anything like a otosclerosis or the Meniere's or the glomus or the acoustic neuroma, these four are very important essay which you want to have in mind, even though the acoustic neuroma is not asked in essay for undergraduates. Okay, but this carries an important question for you in your entrance exams. So I will prefer you to read now. Actually, read while you are preparing for your while you are appearing for your pre-final exams. Okay, the glomus, otosclerosis, Meniere's. Very, very important. Never forget this. So in ENT, so what are the questions I said now? Okay, the other thing, like one more thing, which has been asked nowadays in MGR University, those who are appearing in the MGR University exams, there have been a lot of questions like assessment of a deaf child. So nowadays, this is again a trend setting question, assessment of a deaf child. So why it is trend setting is since nowadays we are starting to do a cochlear implant surgery. So it depends on, say the examiner is going to frame, if they are going to frame a new question, that is going to be something like whatever, if we are improvising, like we are doing a cochlear implant on a deaf child. So nowadays, last 3 or 4 years, there have been questions on assessment of a deaf child. So in this, like I said, so you need to have the mind, what are the syndromes, what are the etiology associated with it, and then what are the practical aspects. So how am I going to treat this deaf child? So what are the investigations I can do? Okay, so this is how the things we want to have in mind. So we were there with the third day. So first day, usually when we put on a timetable, I will ask you to start with the anatomy. So anatomy, physiology, assessment of hearing. Try to read the topics in a day. Okay, so when the second day, when we have ample number of time, we can spend some time reading the concepts. The second day, go ahead with the diseases. The otitis externa, obviously there is not much important with it, but make sure that at least you read once. There are just in a textbook, when you have some textbook in hand, or when you just read an app platform, it won't take more than 2 hours for reading a otitis externa. So like, how are we watching a movie, or how are we sitting and reading some storybooks? Just read it. Even if it is not important, it will be helpful somewhere in your exams. Okay, so the next day, start with the ASOM, the otitis media. Otitis media, once you start the chapter, I will expect you to finish starting from this ASOM, the sequelae of serous otitis media, and the chronic suppurative otitis. These are the sequelae. So once you finish the sequelae, it's like the Game of Thrones, season 1 to if I ask Raghunandan to watch all the series of Game of Thrones in a day, I hope he will do. So that makes us interesting. So if I finish if I just read one topic a day, and then I will simply leave it, and I think of reading it, taking it after a week, I will simply forget it. So once I do a ASOM, start with the sequelae, then what happens if I don't treat the ASOM, or if the patient doesn't come back to me, what will happen? So that is like Todarum, that is like the intermission. Okay, so go to the CSOM and then finish it off. Don't leave it as okay, we will finish it on the next day and all. Just finish that episode fully. ASOM to CSOM, CSOM to complication. Finish that episode, then close that. Then the next day, take on. Next day, start with the diseases. So in the diseases, like the specific diseases, these four are the special diseases. So these all will carry some time, but once you understand, these are easy, since everything is a essay. Okay, everything is essay. So you need to spend some time on it, not more than 2 hours. Say otosclerosis, if I'm just reading for the first time also, I won't spend more than all the students, they won't spend more than 2 hours. Okay, since they're not much difficult, and once we understand the concept, maybe the theory classes, or maybe the platforms or app platforms, that will make you simplify. Okay, so this is how we want. The next day, go on for the diseases, otosclerosis, Meniere's, glomus, acoustic neuroma. And the next day, take on how am I going to assess a deaf child. So assessment of deaf child obviously is somewhat some miscellaneous topic. It's not that easy. Even if you ask me right now, what are the causes of deaf child, I can say some 2 or 3 causes. But the thing is, while you are assessing a deaf child, the etiology nowadays they are asking, just split it up into these questions. If they ask in essay, split it up into the factors. The maternal factors, that is the mother getting the hearing problem. Sorry, the mother taking some drugs or some infection because of the child is getting deaf mutism, or the infant factors. That is, in the infant factors, again further divided into during birth or after birth. So once you split the etiology like this, once you divide it in like this, the examiner will be very happy. Those who are correcting the paper, they will be very, very happy. Oh, we are correcting a topper paper, man, then put on the full marks. Obviously, they won't put a full marks, that I knew that. Even there is a 20-mark question, obviously they will try to put some more than 15 marks. Okay, so these are the questions which are important. Okay, in the same day, once you finish the deaf child, you can finish the remaining topics, the rehabilitation. Rehabilitation topic, rehabilitation is not, means they are not going to ask much in the essay, but they are very much important in the short note, like the cochlear implant, like the cochlear implantation. So, okay, like the implantation, like a cochlear implant, which is, sorry. Cochlear implant is now one trend-setting question in most of the question papers. You want to understand what is cochlear implant, why it is kept, and what happens if I don't keep an implant, and what are the complications which can happen, right? So the next day, take on the surgical aspects. Okay, now, so once I take the surgical aspects, So that's what I say. Once you start with the ear, try to finish the ear. Don't leave the surgery alone. Okay, I'm just leaving it out. I will do it after the nose. Don't do like that. Try to finish the surgery. In the surgery, what happens? Say, if I want to just simplify in a single minute. Okay, so there are 5 surgeries which we want to know in a year. Right. One is just put an incision in the tympanic membrane to let the fluid out. That is myringotomy. Okay, myringotomy is, say, if the middle ear is full of fluid inside, the middle layer is full of fluid, I need to put an incision so that I can let the fluid out. That is myringotomy. Right. Myringoplasty, that means myringoplasty is, say, if there is a perforation, I'm just going to reconstruct the tympanic membrane. That is myringoplasty. Sorry. Okay, I'm just going to reconstruct the tympanic membrane with a graft. That is myringoplasty. Okay. The next thing, go to the tympanoplasty. Tympanoplasty is nothing but, say, along with the reconstruction of the tympanic membrane, I'm just checking for the ossicular chain status. That is tympanoplasty. Okay. Then go to the mastoidectomy. Mastoidectomy, say, this is the middle ear, this is attic, this is the aditus, this is the mastoid antrum. Have this in mind. So once, if I just drill over this area, it is called as cortical mastoidectomy. But if I drill the entire area up to this area, making it a single cavity, it is modified radical mastoidectomy. Okay, so if I want to simplify, this is easy. But for you, if you don't know anything about it, just go read it. This is how I can frame it in a single paper. If I want to frame the surgeries in the ear, this is how I can frame it. Okay, so for any surgeries, okay, first have in mind, they may ask you a surgery in a essay also, or most of time they will ask in a short note. You want to have the indications in mind, the steps in mind, and then the contraindication. Who all I can do, who all I should not do. Okay, the contraindication and then the complications also. What happens if I do the surgery? Okay, so for any surgery, maybe a ear surgery or maybe the nose surgery, like a fist or something, or maybe in the hospital, the cataract surgery, whatever, you want to have any surgeries, if you write indication, the steps, in the steps, you need to mention the anesthesia also, the position also, like a tonsil, they will expect what is the position of the tonsil, what are the contraindications, what are the complications, right? So this is the same for everything, right? So then after I finish my ear, start with the nose. Again the same, start with the anatomy and then go to the physiology. Anatomy and physiology. Physiology of nose is very, very simple. And then go to the specific diseases, right? And in the specific diseases again, we want to have in mind the diseases like the granulomatous diseases, which are a repeated question. The granulomatous diseases, not only in your UG days, it's also for your entrance exam days. Granulomatous diseases, the rhinosporidiosis, rhinoscleroma, very, very repeated topics. Okay, without this, there won't be a paper. Okay, the exam question will have this rhinosporidiosis or the rhinoscleroma. Apart from that, the tuberculosis, syphilis, leprosy, it never means that you need to, you can't skip the topic, but at least read once. The rhinosporidiosis, rhinoscleroma, you need to revise before appearing the exam. And if they ask a rhinosporidiosis next essay, again, start with it. So define, and then what is the organism causing it? What is the etiology and the pathogenesis? Any essay, etiology, pathogenesis, and then what is the clinical feature, and how am I going to investigate, and how am I going to treat it? Once your essay is framed like this, then you are perfect. Okay, so this is that's what I say. While you are reading it, just prior going to exam, the first time once you read it, try to take a notes. The second revision, when you are making it prior, just before the exam, it's not easy to take notes. So when you are reading, starting from the November, once you start the textbook or the app, whatever, just try to take a notes, read it once or twice, so that it will be useful. What are the other questions in the nose? We want to have in mind the sinusitis. Okay, in a sinusitis, again, it's like a sequelae. Start with the sinusitis, finish with the complication. You need to read the complications also, right? Apart from that, Apart from that, the other topics like in our throat, we want to have the tonsil in mind, which is like a bread and butter of ENT or the Bible of ENT, however the chief doctors will say. Without knowing a tonsil, without knowing the blood supply, we can't appear in the exams. So tonsil is one very, very important thing which we should have in mind. Okay, we want to have the blood supply starting from the blood supply to the anatomy, the blood supply, the diseases. Okay, and how am I going to treat the diseases of acute tonsillitis? And if I don't treat, if it goes to chronic, what can I do? And what is a surgery? Okay, so this is how I want to finish in a day. The tonsil, the diseases, and what all the complications can lead to. Try to finish that also in a day. What all the complications can turn to, the peritonsil abscess, the other abscess. So this is how I can frame my learning process. Right? And the next thing, same like that, the larynx is again an easy one. Larynx is again, what I will say, the larynx is easy, not like a ear. The anatomy understanding is very, very easy. The thing what they will ask is, there are some essays in it, like a cancer larynx, which is a very, very repeated essay. And believe it, it's easy to read. It's not that difficult. Have in mind, you have a smoker in front of you. Okay, he's turning into carcinoma larynx. Think of it, just read it. It will be very easy for you. And cancer larynx, and then there are other topics which are important, like a stridor, define stridor. What are the causes of stridor? Okay, and then they may ask you like a pediatric condition like a laryngomalacia, or they may ask you the other conditions like the tracheostomy. Again, it's very, very important essay for you. Okay, again, I will say you may be from different universities. I will ask you to go back to your university question papers, what all the important essays which are being asked. Okay, so they are going to be repeated again and again, but it's not only the important questions which are being asked. It's not like a medicine or a surgery to have a lot of big textbooks with us. Okay, I'm not supposed to read. I can't. I will read only important. It's not like that. Our ENT, I will ask you, even a simple topic is important. Even a tuberculosis larynx is important. Even a leprosy of larynx is important. Okay, so even a simple topic is important. So it's not that like acute laryngitis, the laryngeal trauma, they are not much asked for your exams, but these topics like the cancer larynx, the stridor, the tracheostomy, the pediatric diseases, the pediatric larynx, like the acute laryngotropic bronchitis, or the epiglottis, these are the ones which are being repeatedly been asked multiple number of times. Okay, so now I have finished my theory. Right, you said, okay, I have read for a long time, I have finished my theory. So how am I going to appear in a practical exam? So obviously, this is the first clinical exam you are going to appear. Maybe the pathology you would have appeared for a viva, the session, but you never took a case and you never presented to examiner. But this year, there is going to be a case, a patient sitting in front of you, and you are going to evaluate the history from the patient, and you are going to present to the examiner. Never believe it. It's not that difficult, but it's not that easy to. In an exam point of view, when we just shave our beard off, and when we are in a lot of stress, when we just sit in front of the patient, okay, we even forget to greet the patient and ask their name. Okay, our case sheet without the name also, there will be some lot of patients who don't have even a case sheet, name of the patient and occupation in the case sheets. So first, relax in the exam, the practical exams. Okay, the first thing, while you are appearing in the practical exam, while taking a case, what are the cases they can give you? There will be long case. Okay, again, it depends on the universities. It depends on the university. There is going to be a long case. There is going to be a short case. Okay, but what are the cases? What they will keep you? What they will keep you in a year for an undergraduate? The thing what they are going to keep you is nothing but a chronic suppurative otitis media, which is a safe type. That is otherwise called as tubotympanic type. That is a CSOM with a perforation. So this is what the case they are going to keep you in a year. Maybe it can be kept as a long case, it can be kept as a short case, whatever. Okay, so the cases are going to get circulated. So if Dr. A gets this one as a long case, Dr. B will get as a short case, right? And in the nose, what are we going to? They are going to ask in a nose. noses, they are going to give a case of deviated nasal septum. Okay, deviated nasal septum, or there can be a case of any sinusitis, that is either a chronic sinusitis, or if they get, if we get something like a polyp in the exam, you can get even a case of polyposis, sinonasal polyposis or antropenal polyp, whatever. Again, the same thing. This can be kept even in a long case, or this can be kept in a short case. They are not going to present, they give you any cancer nose. They're not going to give you any rhinospotiosis. Okay, these are the things which they will keep in all the universities for undergraduate. This is the pattern. Okay, and in the throat, there is only one thing. You are going to get a case of, you are going to get a case of chronic tonsillitis. Maybe it could be a chronic adenotonsillitis. If it's a child, it could be a case of chronic adenotonsillitis. Okay, so these are the cases you are going to get in the exam. In a ear, CSOM with a perforation, that is a tubotympanic type. In a nose, either it could be a deviated nasal septum, a simple short case, or it could be a sinonasal polyp, a patient with a polyp with a, can be presented as a long case, and a adenotonsillitis as a long case. So these cases will be circulating. If you get a long case, the other person may get the same case as a short case. Okay, so now whatever the long case or a short case, so now what am I going to do? If I am the student, okay, and you are the patient who is sitting in front of me, first try to greet the patient. Okay, first ask the patient, first say the patient that I'm going to examine you. Okay, in any of the clinical presentation, if the examiner is watching you, first try to greet the patient. That is, first say the patient, what are you going to do? Some examiners, while you are doing the tuning fork test, they will see how are you doing it. In that scenario, first explain the patient. First explain the patient in their local language, like Tamil or Telugu, whatever. First explain them in the local language that what are you going to do? See, doctor, Seema, I'm going to examine your ear. I'm going to place the tuning fork in front of your ear. You will be hearing. You need to, the patient needs to understand. Okay, that is the clinical skill what the MCA is expecting right now. Okay, right now the MCA guidelines are turning into NMC guidelines. Okay, and as per the NMC new guidelines, there are some clinical skills which a pre-final student has to understand. Okay, and the clinical skills is giving a consent to the patient. That means whatever the thing you are doing, the patient has to understand. So that is what the practical exam they will ask you. Maybe the scenario will be framed like that also. Who knows? Okay. So the examiner, 90% they won't sit in front of you, but you are going to see the case. You are going to present the case with you. But this is the important skill you want to understand from the patient. Okay, you want to explain everything to the patient. Then only just okay. See the patient, if it simply sit, just don't put a headlight, shine a torch of light. Okay, write it. Just talk to the patient. Seema, I am going to examine your ear. I am going to check your nose. I am going to check your throat. I am going to see what is the infection there. See, all patients won't be the same. It's not like Vasundhara MBBS to frame a patient and say that I have a ear pain like that. Say the patient who is really a patient now. Okay, he will sit for the first case. Say I'm Ajay. I'm starting with the A. Okay, and the same patient will be for the 25th roll number also. So that roll number, if he is asking, the patient will be yes. He won't be refreshed. He will be answering the same thing again and again. So the thing is how you talk with the patient, how you greet the patient. Never get afraid of your practical exams. Okay, the practical exams say whatever we understand the theory, we are going to apply in the practical. That's it. What the brain knows, we are going to reproduce. That's it. So in the practical exam, again, when we are presenting a case sheet, okay, just start with the name, age, sex. So where is the patient coming from? What is the occupation the patient does? Okay, and then what are the chief presenting complaints? So start with it. Chief presenting complaints. Say I am a case of something like a ear discharge. I have ear discharge. What are the complaints I may say? I may say that I have a ear discharge. I may say that I have a decreased hearing. So the chief presenting complaint. Start with the chief presenting complaint, and then the second thing, elaborate the presenting complaints. Elaborate the presenting complaints indicates, say if I have a ear discharge, okay, so I have a ear discharge. So how long you have the ear discharge? What ear you have, which side you have a ear discharge? What are the aggravating factors? What are the relieving factors? And then how is the amount of discharge you are getting? What is the color of ear discharge? This is how the elaboration goes on, right? And then once you go on with the elaboration presenting complaints, never forget the other history also. So you need to rule out all the positive history and then rule out the negative history also, like no history of, say if I don't have any tinnitus, if I don't have any vertigo, just mention no history of any tinnitus, no history of vertigo, the negative history. And one more thing, never forget any ENT examination never ends with E or N or T. Okay, if you get a ear case, you want to examine the nose, you want to examine the throat also, since everything is interconnected. Okay, a case with a ear infection as will have a eustachian tube block. A case with a nose infection is going to have a pharyngitis. A case with a nose infection is going to have a eustachian tube block, ear infection again. A case with a throat pain will have a referred pain to the ear. Okay, because of the nerve, the glossopharyngeal nerve. So everything is interconnected. So you need to evaluate the other history in the nose, the throat also. Right? Once you finish the history, just make sure the paper is perfect. It should be in this sequence: name, age, sex, where is coming from, what is the occupation, what are the chief presenting complaints, and then you are going to elaborate the presenting complaints. And then go on with the past history. Past history indicates, was there any surgery done previously? Any surgery was done previously? Or whether the patient is any diabetic or a hypertensive or any other drugs which is synchronizing with us with our treatment protocol. And then go ahead with the personal history. Personal history, why it is important, like whether the patient is a smoker or alcoholic, whether it's interfering with us. Okay, and then if it is allergic case, allergic patient, occupational history. So this is how the scenario will be framed. So this is how your case sheet should be. Once you finish it, okay, once you keep on saying, say, Dr. X came to me with the complaints of so and so, came with the chief presenting complaints of, say, most of the examiner will ask you to not to see the case sheet and present. So that indicates your confidence. Some will accept that, okay, seeing and presenting is accepted, but some will expect you to not to see the paper and present. That indicates your confidence. Okay, so the patient has come with the chief presenting complaints, which was aggravated, so on and so. Once you do like that, perfect. Your exams, you are going to clear it without any help, without any internal examination help. You are going to clear it by yourself, right? And the second thing, go on with the examination. And the examination, again I say, ear, nose, throat. Any case sheet, any long case, any short case, the examination should include all these three. Say if it's a ear case, put the ear as first. If it is a nose case, put the nose as first. If it is a throat case, put throat as first, followed by nose, followed by ear, and followed by nose. This is how the case scenario should be framed. At the end of the thing, you need to make in mind the diagnosis. The diagnosis is a must to have in mind. The diagnosis, and the diagnosis, say a case of chronic adenotonsillitis or a chronic suppurative otitis media with a perforation, or a case of deviated nasal septum, or a case of sinonasal polyp. The diagnosis should be perfect. Okay, if your diagnosis is perfect, then you are perfect. Okay, and then what is the next question the examiner is going to ask you? You have finished the diagnosis. The examiner will ask you, how are you going to manage the case? How are you going to manage the case? Okay, so management means you need to do an investigation and then treatment. Never just jump towards it. I'm going to do a surgery. Never do like that. Okay, first start with the investigation and then go for the treatment. This is how you manage. So if I'm getting a case of chronic suppurative otitis media with a perforation, how are you going to manage the case? I'm going to do an audiometry first to check his hearing status. I can't do, okay, I will go and do a surgery. You can't say like that. You need to first go for the investigation and then treatment. If your case paper is like that, then no examiner can try to put you less marks, or no examiner will try to put some black mark on you. Okay, this is how the exam scenario is framed, and make sure this is the first clinical exam you are going to appear. So whatever the history you are going to take, the next question will be from that. Say if you are saying the ear discharge is more of some greenish colored ear discharge, the examiner will ask you why you say it as a greenish. If you say that ear discharge is watery, the examiner will ask you what are the causes of watery ear discharge. So that is why I will suggest you go back to your notes or go back to your books or go back to your app platforms in which it will be clearly mentioned that how are you going to present the case scenario, which is very, very important. If you say that if you are getting a case of CSOM with a perforation and you are saying it is a watery discharge, then the examiner will stop you at that point. What are the causes of watery discharge? Can a CSOM present a watery discharge? Definitely not. A CSOM is going to present a mucopurulent discharge. If it is a watery, think of a CSF photoria. Okay, so each and every word is very, very important in the history taking while presenting in the case. And in the investigation management, they will ask you the theory concept, that's apart. But while you are presenting the history, each and every word is important. If you say no history of tinnitus, what is tinnitus? Why you are suspecting tinnitus in this? You can't, for a ear case, you can't ask, say, if there is a 80-year-old party, 80-year-old grandmother sitting in front of you as a patient. Okay, say if you ask party, you have any leg pain, she will say yes. But what way it is synchronizing to us? So we need to evaluate only the important history, not all the history patients is. Don't write everything, so and so, blah, blah, blah. The patient has a ear pain, the patient has a spinal cord problem. Never leave it out. Leave it out. Okay, whatever relating to our ear, nose, and throat, put on the case sheet. Don't write the patient has a leg pain, the patient has a hip pain, the patient. Never write this sort of stories in the practical exam. Okay, and the next thing, okay, you are done with the practicals. Okay, so this is the practicals. Again, the next thing, as I say, the history, they are going to ask what are the causes, what are the things, how are you going to proceed with it, the investigation, the management, which are very, very important. Okay, and the Viva session, have in mind, you will be facing some image-based scenarios, like audiometry, they will keep a skull-based foramen in front of you, or they may ask you the instruments. The Viva session is not much difficult once you understand the theory. Okay, the practical scenario, the presentation of case is very, very important. Okay, the theory, understanding the practical. Once you understand the theory, then go to the practical. How am I going to appear? How am I going to evaluate? How am I going to pull the pinna? How am I going to place the speculum? Okay, how am I going to clean the discharge? Everything is important. How am I going to do a tuning fork test? How am I going to examine the nose? How am I going to do a posterior rhinoscopy? Obviously, they won't ask a posterior rhinoscopy, the anterior rhinoscopy. Okay, and what are we doing in the indirect laryngoscopy? Everything is important. Okay, so this is how we want to frame a timetable, and this is how you want to appear in the exam. Okay, there are a lot of, so obviously whatever the textbook you read, there will be everything in the textbook. There won't be much, there won't be any point missed in your textbooks. Okay, and as I say, reading a textbook will be boring for some people. So obviously me, when I just sit in front of the textbook for some time, obviously I will be sleeping after some 1 or 2 hours without knowing me. So for some people like me, or like the scenario is changing, there are a lot of app platforms, and even as Dr. Raghunandan has mentioned you, there is an app platform which is exclusively made for pre-finals by me. That is Dr.Ajaiy ENT. Okay, in that actually we have all the concepts, whatever we explain, starting from the how to write the exam. So starting, say, when I'm taking a case of ASOM, I want to understand the staging first. If I understand the staging, then I can write the rest of it. Right, same thing. So what I supposed to take a case. Okay, so in a case taking, so what I want to have in a case taking. So I have tried to compile all the platforms, like the complete theory and the complete practicals, whatever the case scenarios. I have mentioned the history taking, the case presentations, and the investigations and management in my platform. And then the instruments and the clinical skills, what the NMC is going to frame for you right now. The syringing methodology, right? The nose foreign body removal. What all the clinical skills a pre-final student has to know in the practical exams while appearing in the exam. So I have tried to compile all the practical skills also. How am I going to pass an endoscopy? How can you put an indirect laryngoscopy? What all the questions the examiner will ask you? So hopefully it will be very helpful for you, the app platform, which Dr. Raghunandan will be sharing you the details. And And I hope this is how you want to write in the exams. And starting with it, right now it's not too late. So starting with the November 15th or whatever, 16th or whenever you go to the exams, put a proper timetable. So that's as I did, split up into ear, nose and throat, put a proper timetable. Make sure that you are spending more time on other subjects also, like SPM, which is a very big book. I accept that the park is not an easy book. The park is a very big book and we need to spend a lot of time on it. ENT is a small book, so we can adjust the time accordingly. Okay, I'm not saying ENT we need to read a lot of time. You can just compress the time for it. Make a timetable. First time when you read, try to read everything. Not only the important question, try to read everything. The second time, when you don't have any ample time, like November when we feel sleepy, in the December or the Jan when we try to take the book, if we don't have adequate time, what are the important things, what I said now? These are the important essays, the important questions. I didn't mention some important questions in the notes like JNA, the nasopharyngeal carcinoma, the epistasis. But see, that's what I say. The first time when you read, try to read everything. The second time, try to go back to your previous 5 or 10 years question paper, check what are the important questions and try to repeat it. So that's what I say. First time when you read, take a note, take a proper notes, and then put on some line diagram. So this is how I can do in the exams. And then when you appear in the exam, it will be very easy. Even if you study in November, you can even if your exam is postponed to May, you can remember it back even if you don't revise it. So that is what the first stage you can first time the concept understanding will point towards. Okay, so fine. Any doubts, doctors?
Yes, sir. There was a question in YouTube. So how to tackle tough situation, like tough questions during a presentation during the history taking and examination, when an examiner asks us a tough question which we don't know, how are we supposed to respond to that?
Okay, say it's not that, I don't understand what is tough questions. Okay, say tough questions indicate, say the same thing. Say for some students, if they are presenting like a case of, say if some students who are toppers, okay, it's not that say when a topper is going to present in exam, okay, say if he is overconfident, what he will do, okay, case of so-and-so, case of CSOM with CP, so presenting with so-and-so, in the scenario, what he will do, while examination, he will also say that the vestibular evaluation or the facial nerve. Then once you say that the facial nerve, the examiner will ask you, what are the facial nerve muscles you are going to test, how you are testing the facial nerve. So we can't be overconfident and we can't be underconfident also. Say, like as you asked me, some tough questions. Okay, it's like tough question indicate, say a case of chronic suppurative otitis media with a vertigo. Okay, you say that no history of vertigo. If the examiner wants to fail some students, there are some mindset of examiners, we can't comment on that. If the examiner wants to fail some students, he may ask you why there is vertigo in your case, or what is the use of asking vertigo in your case. The answer is, we want to understand the concept, what is vertigo and how the CSOM is turning into vertigo, right? So that's what I say. The examiner is not going to frame a tough question. The tough question comes from the student's mouth. Actually, what happens here is, say if we don't know about vertigo, say if we don't know about tinnitus, say I didn't read about tinnitus. Okay, never say tinnitus. Okay, if you say tinnitus, you are caught. Okay, it's try to avoid that scenario. If it's not that you say if I don't read, I can't avoid everything. Say if something like like the tinnitus or the vertigo, if you don't read, okay, if you are feared that the first student has got caught and got a lot of scolding from the examiner, the second student I'm going to go, just try to avoid the no history of tinnitus. Okay, then you will be saved from the question. Is that the question you asked Dr. Raghunandan or something else?
Yes, sir, that was the question which was asked. And what are the important surgeries which we have to focus, sir, with regard to university exam?
Yeah, so that's what I say. ENT, in a ENT, we don't have much of much and much of surgery. So okay, I can skip out this topic, I can skip this topic, I can skip this topic. We don't have much surgeries like that. So we want to have in mind the surgeries, whatever the things we said. The myringoplasty is important, myringotomy is important. That's what I say. Try to do it in a sequel. So start with the myringotomy. So what happens in a myringotomy? Myringoplasty. So myringoplasty, then tympanoplasty, and then the mastoidectomy. Okay, no surgery is inferior to anything, since that's been asked. Say this year they are asking cortical mastoidectomy, the next year they will ask a modified radical mastoidectomy. Okay, say modified radical, the radical, modified radical, the radical mastoidectomy, the cochlear implant surgeries, they are not asked much, but these myringotomy, myringoplasty, tympanoplasty, the simple mastoidectomy, that is cortical mastoidectomy, the modified radical, these are all important. Okay, modified radical, if we don't have time, say tomorrow is our exam, say the next week is our exam, if we don't have adequate time to read, modified radical, radical is not much important, it's not been much asked. But again, I say the surgical topics, once you read it one time, it will be very easy. Okay, it's not that we need to go back again and again. Or again, I say, if you have some doubts, you can go back to the platforms like this, in which okay, in my platform I have explained in a stepwise approach. There are other platforms also in which they will explain a stepwise approach also. Like in a FIS, we want to have the FIS in mind, like a sinusitis. We want to have the tonsillitis in mind, and tonsillectomy in mind, the adenotonsillectomy in mind. And as you asked me, what are the important surgeries we want to have in mind, the case scenario. Say, never, the case presentation never ends without a surgical topic. When you go with the ear case, a chronic suppurative otitis media with the perforation, the examiner will finish you only if you say the mastoidectomy or a tympanoplasty, whatever. So for that, you want to understand the mastoidectomy, you want to understand the tympanoplasty. Same thing in a nose. If you get a septum case, you want to explain a septal correction. If you get a sinusitis, you want to explain a FIS. The examiner will ask you what surgery you will do. Say we are in a MSc ENT, that is, ENT is a surgical oriented, not a medical. So we want to have the surgeries in mind. And a tonsillectomy, a must known topic. Without knowing a tonsillectomy, I will simply say that it's very hard to appear in the exam. Since tonsillectomy, the complications of tonsillectomy, the hemorrhage, any examiner will ask it. Okay, even if you don't explain the tough questions, it's not much important. But the easy questions, if you miss to answer, then you are in a state of some problem. The easy questions indicate what is the position of tonsillectomy, what is the surgery, what is the surgery technique of tonsillectomy, which day you do in your college. This is what they will ask you, any examiner. Obviously, you will get an examiner from other state. They will ask you, what is the tonsillectomy you do in your college? Okay, and then what are the complications and what are the types of hemorrhage? Once you read that chapter, you will understand that. Okay, fine.
Thank you so much, sir. Thank you so much. So it was really a wonderful session where actually we expected only you to cover what are the important topics, but as a bonus, we also got how to take a history taking and how what are the things we supposed to concentrate in the university exam. It was really a nice session, sir. And one more important thing is how to make our study more effective for future entrance exam. Whether we need to concentrate MCQs side by side. There is one question like this, sir.
Yeah. A nice question actually. Say I have been in this NEET platform, the NEET PG platform for the last 4 years. Okay. Say nowadays, who knows that for your batch, the NEET PG may turn into next also. Okay. Till now there was no proper notification for that, but it's better while we start reading from our UG days. Say it's better to put on a MCQs also with it. And again I say, now this year itself the clinical cases are changing. So previously there was some one-liners, but now there are some clinical cases. Like the last year, if there is a simple case like a 20-year-old pregnant lady coming with a hearing loss, which is aggravated by pregnancy, what is the diagnosis? This was the question which is being repeatedly asked in the NEET or the AIIMS or the JIPMER, whatever. They will repeat that questions every year and they will ask it options A, B, C, and D, and what is the rest of the answer. But now how is the question being framed? Even for the FMG, how is the question being framed? A 28-year-old female coming to your OPD, she comes with a decreased hearing, and on examination, Rinne seems to be negative, Weber seems to be lateralized to 1 ear, ABC is not reduced. So what does that mean? They are going to, they didn't say hearing loss, they didn't say conductive hearing loss. They are giving the tuning fork test to test whether you know the tuning fork test. And now you are doing an investigation on the patient, and the investigation, you are doing a tympanometry, and what will be the tympanometry pattern in this patient. This is how the clinical scenario nowadays is framed. They are not simple, they are not asking a simple one-liner. They are testing you whether you understand the concept. So that is what I said, starting from the while you read that UG scenarios, undergraduate essays, it's better to understand. Since as the next comes, okay, there may be some clinical cases. They may give a case like this, the same question. They may ask some 2 or 3 questions like what is the diagnosis, what could be the impedance pattern, and what is the treatment you will do. Okay, so no one knows that what is going to happen, and it's better in a competitive exam, like the scenarios are changing. It's better once we understand the concept. Say it's nothing like these questions are important for NEET, these questions are important for undergraduate. Nothing is like that. Nothing is like that. Everything is important for NEET, everything is important for undergraduate. Obviously, if a small topic like a tuberculosis larynx, like tuberculosis otitis media, these are some topics which you will miss in the pre-final days, but they are important in the NEET exam test. And the rest all the same thing. Whatever you read in your pre-final days is the one you are going to reproduce back in your NEET or the next exam. Okay, it's the concept which we want to understand. There is not much difference between a class taking for a pre-final and a class taking for a entrance exams. Okay, only thing in the entrance exam is they are not going to ask you the etiology. That's it. Okay, the etiology they can ask you. It's not that, say, while you are presenting the essay question like epistasis, you want to write some 10 points with it, right? But that doesn't mean that that is not the same in the practical scenario. In the in the next scenario. The next scenario, it will be something like some, if you just know what are the management, that is important. It doesn't mean that the etiology is important. What are the causes of CA larynx? That are all not much important, right? So just try to understand all the concepts in the pre-final days. The subjects are very easy. I can't say it's very easy. If we understand the concepts, they are very easy. Okay, so understand the concept. That will be important for your NEET or the next whatever which comes into road. Okay, right, Dr. Raghunandan, any other doubts?
Thank you, sir. There is no more doubt. And also, is there any chance? Because like now we are all as a pre-final year and as a 17 batch who will, as you said, we are lucky enough or unlucky enough to write the exam first. Exam first. So everyone has a fear that it is somewhat very tough exam like that. So as you told, it is just a exam which is changed, name is changed and is oriented towards a clinical concept. That's it. But is there any specific point which you want to emphasize to students that compared to NEET exam which is existing now, is there a specific change which is going to happen in next, and what a student must inculcate from this undergraduate learning itself?
That's what, see, actually, that's what I say. Maybe the NEET, maybe the next, the concepts are going to be the same. They are not going to ask the algebra in ENT. Okay, they are not going to ask the others of the social science in our ENT and all. The same thing means in our next exams and all. The things are going to be the same. The concepts are going to be the same. It's how they are going to ask is going to change. Like whatever I plan, whatever I pattern now. Now the combined exam, the AIMS has turned into INICET, right? The combined entrance examination. So what are the patterns they have kept? Match the following: true or false, assertion, reasoning. Okay, the clinical case discussion. So this is how the next will also be. Okay, no one knows that this will be the pattern. They haven't framed anything till now. Maybe we need to wait for some 1 or 2 months before the pattern comes. But this is, but they are going to ask only the concepts again. The question may be more of a practical oriented approach. Again, never get feared of a topic named next. Okay, next is nothing but the exit exam. Why it is being framed? There are a lot of medical universities in which the studies have not been perfect. So once they come for examination, they're trying to read, but say a foreign graduate who is sitting in other countries, they won't have much time. See, ENT is a very small, maybe some 1 month topic for them, not a 1 year topic. So for them and all, for scrutinizing all the universities, they are making the NEET into next. Okay, but I again say never get frightened by next. The topics are going to be the same. One thing, just concentrate on your basics. Say if it's going to be ENT, the same thing, ASOM, what are the staging? How am I going to manage? If it is going to something like a medicine, like abdomen pain, so what are the causes for abdomen pain and how am I going to treat it? So we want to have in mind, how am I going to treat the patient and what are the practical skills which are needed. Apart from the one-liners, the signs, say a brown sign or a delta sign, the Phillips sign, the signs are going to be repeated again and again. They are going to be the one-liners again also. Okay, but one thing is we want to understand the concepts. Nothing else. No one knows the pattern. Even I don't know the pattern. Even I hope so. The NMC also doesn't haven't framed the pattern till now. Okay, but who knows? It will. You can get it in 1 or 2 months probably. The announcement of next will come, but don't fear about it. The scenario is going to be the same. Just understand the concept. Whatever you read in the pre-final, you are going to produce it in your final year exam or the next exam. Yeah.
Thank you so much, sir. It was really a wonderful explanation and a boost for our students who are waiting eagerly to either reopen the college or when the university exams will be there. Lots of confusions. Okay. But anyway, let's see. And as you told, we have to start our preparations, and whenever the exam is going to be, we are the one who are going to write. So we can just start. And I would also wanted to tell to all the audience that Dr. Ajaiy sir is also having his own platform, educational platform, where he has given a complete instruments or clinical case discussion, practicals, theory, everything in which is necessary as a pre-final MBBS or as a NEET PG preparation. Everything is given in a single app, which is also very less. And today, because he is conducting a session in our platform, he has also given discount for the students who are viewing our platform also. Just at $9.99, he is giving the complete masterclass in ENT for 1 year. So those who want to subscribe, they can just subscribe using the coupon code which is given below, MEBUENT. So you can use that and you can also get the discount. So apart from it, sir is also taking a lots of time to also give contribution to our motive in our medicine. We also expect him to in future to help us in clinical case discussion also, as I already discussed with sir last week. We are also bringing up clinical case discussion and live presentations in our platform. We probably at the end of November, we will start with Hostel and ENT clinical case discussions. So I expect everyone to give same support to us. Just now I saw nearly 200 people have viewed it live in our YouTube channel. So it's really a good gesture from you all. So I expect the same support from everyone. And also, please, you can also subscribe to his complete masterclass app. It will be very useful for you all. Thank you so much, sir. In spite of your busy schedule, in spite of your app preparation and everything, you have just allotted a time for us also and just joined here. It was really a wonderful session, as already told by even in our chat box. So it is really a wonderful session where you covered everything A to Z of ENT. So it will be really a kickstart for everyone to start their preparations. And I also request everyone, just start your preparations now. It is not too late. We can just start our preparations. We also have regular quiz sessions in our Telegram channel. You can also join that. You can also just side by side, we can read it and crack our exams. Thank you so much, sir. Thank you for joining today.
Thank you, Dr. Raghu, and thank you all the participants who have been there till the last 1 hour. Okay, so I hope I have given some time. I have boosted you to start with the textbooks. Hopefully it will be helpful for you. And thank you, Dr. Raghu, and thank you, medicine team, who have taken this responsibility for boosting the students. Hopefully, I hope that all the students will be in a mindset that, oh no, the college is going to reopen. What can I do? So it will be something like a boost for the students, to those who go to college, what they can do. So it's a very nice platform taken by you guys. And I hope this session will be very helpful for the participants who have come, who have watched it. And thank you for those who have been sitting for the past 1 hour continuously, who have been listening to my discussion. And don't worry, just read whatever the subject, like you are watching a movie. Okay, like watching a movie. Once you read that, it will be very easy. Very easy. Whatever the subject you can read, just read it like you are going through a movie. Like how we watch the series of House. Okay, so watch it like that. Read it like that. So it will be very helpful for you. Thank you. Thank you. Thank you.
Thank you, sir. Thank you so much. And I also like to take this time and to thank Dr. Balaji Chinnasamy, sir, a pediatrician and also he is a patron in our channel, who is contributing a lot of time, and as well as material wise also he is contributing us, and who is very helpful in conducting this session. And I also like to thank Dr. Kavya ma'am, who is a clinical pharmacologist in SRM Medical College, who is also there in this meeting, who is helping us technically in arranging the sessions. And I would like to thank Ari Prabhakar, who is helping us in editorial team, who is preparing posters and everything. Thank you so much. And thank you so much again, sir, for joining. And let's hope more great sessions will be carried out in future. Thank you, sir.
Sure. Thank you. Thank you.
Okay, sir. Thank you, sir.
Yeah.